there, my name is Ashley Agnew and I'm the pediatric occupational therapist working at Extramural in Miramichi. So I'm just making this little video to promote some awareness around autism and how and what occupational therapists do in order to help children with autism. So my first question is, what is occupational therapy? And my answer to you is that occupational therapy can be home or school-based therapies that help your child to achieve things that they need to do, that they want to do, or that they're expected to do. So those things can look different depending on if it's school-based therapy services or home-based therapy services, but that's kind of the gist of how OTs can help kids on the spectrum. So how we can help kids on the spectrum is by providing consultation, or we can do intensive therapy services to help your child kind of in a nutshell become more independent. So if there's things or tasks that your child is having trouble doing, then that's kind of where OT comes in, and we kind of help to problem solve around the issues that they're having and help them to be successful in their tasks that they're doing. So what are the ages to receive occupational therapy? So in Miramichi, we divide it up a little bit. Usually if you have a child who's 0 to 5 years of age, they're seen at the hospital in an inpatient setting for occupational therapy services. But once your child gets to school, the school-based occupational therapist, or myself, can see them right in school or at your home if you prefer. So usually the Extramural program where I work, we see children from about 5 years of age, so when they enter kindergarten all the way up to grade 12. And how can a parent access these services? So a simple referral is all that you need in order to receive OT services at school. And all we need is your parental consent in order to be able to go in and see your child. And how would parents know if their child would benefit from occupational therapy? I would say to this question, the biggest thing you should ask yourself is if your child is having difficulty doing something. Again, going back to the doing. So if they're having trouble, getting dressed, if they're having trouble getting their work onto paper, if they're having trouble regulating sitting down in class and being able to attend and those things. If they're having trouble doing something specifically, then that might be a time when you want to get some OT intervention for your child. And my last question here is, can a child receive OT services in school? And yes, they can. I think I've said that a couple of times. At Extramural, we do service the schools. We could provide service at daycare. We could provide service at the Autism Resource Center. And like I said before too, we can provide service in your home, if that's where you feel the most comfortable, and where we can get the most bang for our buck. The child will feel the most comfortable, and hopefully we'll be able to provide some therapy services for you guys. So that's all that I had to say. Those are all the questions. So thank you so much for your time, and have a great day.